is Dr. Selvanagam. How can I help you today?
Hi, I'm here to pick up my Proair.
Okay, sounds great. Do you mind if I ask you a couple questions just to kind of orient myself so we can better do this process? Before we get started, just tell me what you think the inhaler is for.
Oh, it's for my asthma, but when I look it up online, I saw a lot of potential side effects like wheezing. It's gonna increase the wheezing, and then something like the paradoxical bronchospasm. So I'm really worried about that. So I'm not sure if I'm gonna take it.
Right. Yeah. No. So I commend you on doing some research before you came in. That's really recommended. So you're correct. It is for your asthma. So sometimes with asthma you'll get exacerbations and flare-ups. So this is for immediate relief or quick relief of those symptoms. So typically when you have an asthma exacerbation, you have your airways in your lungs get constricted, and so this helps to kind of dilate those bronchioles so that you can breathe better. Okay? So it's for like quick relief of those symptoms. Okay, that's the main thing. Second thing is that you can use it exacerbations that are brought on by exercise.
Yeah.
So in those conditions you'll use it before exercise to kind of relieve that. Okay.
Yeah, the doctor told me like a couple of puffs before exercise.
Right. Yeah. So you're gonna use it 1 or 2 puffs for 5 minutes. 5 minutes before exercise. Correct. But for you, this indication, you're gonna use it 2 puffs every 4 to 6 hours for your exacerbations whenever you have them. Okay. And as for your concern about the wheezing, there is that. That's what you refer to as the paradoxical bronchospasm. You don't have to know what that means, but just know that sometimes when you use a new canister, you can have an increased risk of wheezing.
Okay, what should I do if this happens?
So if you have that, you should definitely stop using the device and then go talk to your doctor. But if it's an emergency type situation, go to the ER for sure.
Right, sounds good.
Okay.
Yeah.
Do you mind if I show you how to use that?
Sure.
Okay, so the first thing you want to know is that this comes in 3 parts, right? So you have the mouthpiece, you have the actuator, and you have the canister. Okay? So every time you put in a new canister, or for canisters that you haven't used in 2 weeks, we recommend priming it. So the way to do that is you want to take the mouthpiece off and you want to do 3 releases into the air away from your face. So you want to do it away from your face because you don't want to breathe it in, obviously, right? Sure. And so you do that so that each time you actually use the inhaler, the full dose goes into your system and it's more efficacious for you. Okay? So a couple things. Each time you use it, though, you want to shake it first. Okay, so make sure that medication is evenly dispensed. And when you insert the canister, make sure it's nice and snug and there's nothing blocking the mouthpiece. Okay. So now to actually use it, obviously it's done by mouth because it's an inhaler. So you want to take the mouthpiece out and you want to exhale or take a deep breath out completely as much as you can. Put the mouthpiece in your mouth and form a seal with your lips. Okay. And then what you want to do is you want to take a deep breath in, and as you're doing that, you want to push down on it simultaneously so that the medication goes into your system. Okay, as you're taking the deep breath in, and then you want to hold it for 10 seconds. So that makes the medication linger in your lungs so it works better for you, okay? And then you exhale, and then you're done. And so in your case, because we're using it for 2 puffs every 4 to 6 hours, you want to repeat this procedure, okay? So you got that down, or do you feel like I should explain it again?
No.
Okay, so after you've done that, I want to show you how to for maintenance, right? Okay, so for maintenance of the device, you want to make sure that you clean it. So the way to do that is you want to hold the mouthpiece under hot water or warm water for about 30 seconds and then shake it off so that the excess water gets dried out. Okay? Other than that, you should be set. And then there's a dose counter on here that keeps track of how many doses you have left. So new canisters typically have about 200 doses worth. So after you do the priming, you'll see the number 200 appear on here, and that helps you keep track of how much you have left. And we recommend you renewing it or getting a refill when you have about 20 left, so it helps you keep track of it.
Oh, perfect.
Okay. Yeah, go ahead.
Can I actually, keep it in my purse everywhere I go? I mean, how should I,
So I wouldn't recommend keeping it in your purse only because you might keep it in like the hot sun. We recommend keeping it at like a room temperature, so avoid extreme colds or extreme hots. Also, whenever you use the canisters, make sure you only put the Proair ones in here. Don't use ones from other companies. Okay. Also with storage. Again, like I said, you want to keep it away from the hot and the cold, but also make sure that you never use an expired one. Okay? So whenever it's expired, just throw it away in the regular trash. Also keep track of your dose counter. When this hits 0, you can also throw it away, and keep it out of the reach of children.
Oh, perfect.
Okay?
Is the wheezing the only side effect I should be concerned about?
So like I said, the wheezing is pretty rare, but we do have that. There's some other side effects that we're going to go over right now. But keep in mind that these are very uncommon, and so you don't have to really be concerned about it, but just be aware of it, okay? So the side effects include like an elevated heart rate, so you'll feel your heart beating a little faster. You might also feel a little bit of nervousness, a little bit of headache. Sometimes you can also have a sore throat and a runny nose, okay? So keep those in mind. On a different note, if you experience like a rash on your skin or like itchy skin or even like swelling under your skin, that can be a sign of an allergy. So in that case, you want to stop using the device and then talk to your doctor about something else that we could switch it to. Okay, so like I said earlier, this medication is used for active flare-ups, so like exacerbations. So what that means is that it's for a quick relief. Okay, so if you find yourself using this long-term over months and months, then you need to talk to your doctor about that because this might not be the suitable therapy for you. So you want to switch it to something else.
When should I see my doctor next?
I'm glad you asked that. That's actually a really good question. So typically we recommend that you see your doctor or come see me every 2 to 6 weeks after you start your therapy. So that'll give us the best indication of how this is working for you, okay? So within those 2 to 6 weeks, I want you to keep track of your usage of this device because that is the best indicator for us to know whether this is working for you or not, okay? Especially if you're using it more than 2 times a week. We want to know that because that means that we need to up your regimen and like increase it to something that's more effective for you. Okay, so here's your device back.
Thank you.
And I actually made a action plan for you. Okay, and we're gonna go over this, and I'm gonna hand this to you before you leave today. So this has details of the daily management and maintenance techniques that I told you about, so you can keep track of those. It also helps you guide and understand better whether your disease is progressing or regressing. Okay, so what that means is there's a tracker on here for you to keep a log of how frequently you use your device, and so as healthcare professionals, it helps us to manage your therapy better. Okay, so that's really important that you keep an accurate log of that, so we know how to better treat you next time. Okay, so like I said, I'm going to give this to you before you leave, and then this should address most of your concerns. But if you have any other questions, obviously I'm happy to help you with those. Okay.
Thank you so much.
Okay, so here's the action plan that I told you about. So definitely use that. It's going to help you a lot to keep track of whether your disease is progressing or regressing, okay?
Great.
So that's important. So before I let you go, I want to make sure that you feel calm and ready and excited to use this device because it can really improve your quality of life. We're going to hit some of the main points to make sure that you understood them correctly, okay?
Sounds good.
So your frequency of use is going to be, 2 puffs every 4 to 6 hours?
Yeah, as needed.
Right, as needed. And then it's going to be for immediate relief. So you're going to feel this pretty within minutes, I would say. Okay. And then we're going to prime it for new devices. You're going to do it like 3 times into the air, and they're going to do that for new canisters, like I said, or for ones that you haven't used in 2 weeks.
2 weeks.
Okay. So you have that down. Also, you want to clean the device once a week. So hot water, 30 seconds, shake off the water. Okay. And then we went over the side effects. So elevated heart rate, runny nose, sore throat, that kind of stuff. So you feel comfortable. Again, it's not going to be anything uncommon. It's very like rare incidences, and a lot of people don't report having any issues with it. It's well tolerated.
Perfect.
Okay. So hopefully you can come see me again very soon. And if you have any questions, I'm happy to help. I'm at the pharmacy from 8 to 5. So come through and talk to me whenever you have, or just call the pharmacy if that's easy for you.
Sure.
Okay.
I'll see you in 2 to 6 weeks.
That sounds great.
Thank you so much.
Thanks for coming in.
Thanks.
Take care.